Good afternoon, everybody, and thank you for joining us. We wanted to share some critical updates on North Carolina's efforts to fight COVID-19. As of today, North Carolina has 3,426 confirmed positive cases and, sadly, 53 deaths. We've learned that test results have revealed a hotspot of transmission in Orange County. A series of tests for COVID-19 have revealed that at least 60 positive cases in a skilled nursing facility in Orange County, with more likely to come. Of those, 7 are hospitalized and 2 have died. These are shockingly large numbers. And I wanted to share some information about what the state is doing to combat and control outbreaks at long-term care facilities to protect both residents and staff. We're tracking these outbreaks closely because we know that by nature they can be hard to control. As our concern has grown about long-term care facilities, the North Carolina Department of Health and Human Services has added data to its public dashboard. One of the items being tracked and shared is the number of outbreaks at congregate living facilities, nursing homes, residential care facilities, and correctional institutions. And we are taking steps to safeguard people. First, we have to do everything possible to prevent an outbreak to start with. My earlier executive order has restricted visitors to these facilities, and the Department of Health and Human Services guidance suggests that workers wear protective gear and monitor their health. Direct guidance on closed shared common areas and sanitation are also in effect. Dr. Mandy Cohen has and will issue additional directives that she will talk about in a minute to address this situation. Second, we've accumulated enough testing supplies to respond quickly and aggressively to assess patients and staff in these situations. And this is important because we know that this virus can spread even before a person is showing symptoms like a fever or a cough. This increased testing will tell us which employees or residents may have the virus but aren't showing symptoms so that they can be isolated. And third, we must take immediate action to stop the spread of COVID-19 in this facility and others. In coordination with local and state health departments, facilities that have residents with the virus will group them into a separate area of the facility to make sure that they are cared for by a separate group of staff. This will prevent interactions with residents and staff that are not COVID-19 positive. The increased number of cases highlights the importance of our work to get more hospital beds and the medical workers to staff them. Yesterday I talked about several upcoming executive orders. One of those will be signed today. That order allows more health care providers into the system, and it makes sure that equipment and other resources are available where they can be most effective and save the most lives. The order also increases the number of hospital beds that may be needed for this crisis. In addition, the order streamlines child care rules to make sure that the children of our most essential workers can be cared for while these brave parents do the work that we need them to do. Finally, again, I encourage everyone to follow our stay-at-home order. Follow our stay-at-home order. This pandemic has shown us how interconnected our society truly is. Going out for a non-essential reason may feel harmless if you're not having any symptoms. But if you do have the virus, you could set off a chain reaction unknowingly by passing the virus off to even just a handful of people. They will pass it on to more people, and so on. Or you could go out and you don't have the virus, but you could easily pick it up. Eventually, it could afflict a nursing home like this one, or a friend or a relative who is already sick with an underlying condition. The more we stay at home, the more lives we save. It's that simple. With me today, we have the Secretary of the Department of Health and Human Services, Dr. Mandy Cohen, the Secretary of the Department of Public Safety, Eric Hooks, and Director of Emergency Management, Mike Sprayberry. Sign language is provided by Nicole Fox and Brian Tipton, and behind the scenes, Spanish language interpretation is provided by Jackie Medivere and Jasmine Medivere. I'll now recognize Dr. Cohen for a few remarks. Dr. Cohen.
Thank you, Governor. Good afternoon. As we've seen the number of outbreaks in our congregate settings go up, we know we currently have 21 outbreaks across the state, meaning that 2 or more people have tested positive in those congregate settings. 18 of those 21 are in our long-term care settings. We've been working with our partners, the industry associations, our local health departments, and the facilities directly on their prevention and response actions. We've already issued an executive order earlier, as the governor mentioned, which limited visitors except in extreme end-of-life situations, but now we need to go further. We will also codify additional directives to help further prevent outbreaks. So going forward, we will require all nursing home staff to wear masks when interacting with patients to prevent the inadvertent spread of disease. Second, we'll require all facilities to close communal areas and restrict all non-essential personnel. We'll also require residents and staff to be screened daily for symptoms to detect disease as early as possible. And lastly, also require notification to the local health department of new or suspected cases of COVID-19. In addition to prevention, if an outbreak happens, quick and aggressive action must also follow. Facilities should implement immediately the testing and assessment of residents to determine the spread of the disease, and residents with COVID-19 should be grouped, as the governor mentioned, in a separate area of the facility to make sure they're cared for by a separate group of staff, so there's no interaction with residents or staff that are not COVID positive. This is really hard work. I want to thank our public health teams, and particularly those working in our long-term care facilities. What you do is so important. You are on the front lines combating the spread of this virus, and we thank you. We thank you for your hard work. And one more message to add to the governor is about the importance of staying home. I know this is a particularly hard week as folks look forward to the holidays, to Easter, but this year will have to be different. We'll have to be different to protect one another. Please keep your families and loved ones safe by staying home and finding new ways to connect. It's my sincerest hope that all who celebrate have a meaningful holiday. Please stay home to save lives. Thank you.
Thank you, Dr. Cohen. We're grateful for your strong leadership. Now our Emergency Management Director, Mike Sprayberry. Mike.
Thank you, Governor, and thank you for your leadership. Good afternoon. Today is day 30 of the State Emergency Operations Center activation for the COVID-19 response. 65 counties have activated local emergency operations centers. All 100 counties in the eastern band of the Cherokee Indians have declared states of emergency. We're continuing our work to source and order personal protective equipment. We're beginning to see some small signs that the supply chain is improving, but the market remains extremely difficult. From our very limited supply of personal protective equipment, we're filling resource requests in small, short-term quantities for the most urgent needs around the state. Yesterday, we received word that the cost of activating National Guard resources to support our state's COVID-19 response will be covered by the federal government. That's great news. We currently have about 240 National Guard airmen and soldiers working on a variety of missions, including planning, warehousing, shipping, cybersecurity, and engineering. We also have National Guard liaisons deploying to 10 local emergency operations centers to help with supply management and information sharing. Engineers from the North Carolina National Guard and the U.S. Army Corps of Engineers continue to assess facilities around the state for possible use as overflow hospital space. I want to say a word about food again today. Shelves at many of the state's food banks are close to bare. Many people have lost work and lost income and are relying on food banks to get groceries. Please consider a financial contribution or a donation of shelf-stable foods to your local food bank. You can donate money online. Visit feedingthecarolinas.org to find the website of a food bank near you. And remember, a trip to a food bank to get or give food or to volunteer is not considered a violation of the stay-at-home order. Also, our partners at Crisis Cleanup, who normally help coordinate cleanup services after storms, are now coordinating meal delivery to senior citizens and others at high risk. Visit coronacommunity.org for more information and to sign up for meals delivered to your home by a volunteer. Depending on the provider, there may be a charge to cover the cost of the meal if you are able. The call specialists for North Carolina 211 continue to do a great job helping people with information about food, utilities, child care, and other needs. They're taking thousands of calls a day, and lines are sometimes very busy. If you call 211 and get a busy signal, simply wait a while and try your call again. For twice daily information updates on coronavirus, you don't have to call. Just text COVID-NC to 898-211. That's 898-211, and you can get text in English or Spanish. I want to thank all of our local partners right now and tell them what a great job that they're doing. We're very thankful for that, and we depend on you. We know that you're having a tough time. Hang in there. We're right there with you. Don't forget to call your loved ones daily. Look out for your friends and neighbors and be kind. With your help, we will get through this together as one team, one mission, one family. Thank you, and thank you, Governor.
Thank you, Director Sprayberry and Secretary Hooks and all of the men and women working here at the Emergency Operations Center. Thank you for talking about the need to give to the local food bank and to help those in need now. Also, they're in desperate need of blood donations. So if you have the ability and are physically able to do that, carefully agree to give blood. I know my wife Kristen and daughter Natalie are going tomorrow to give blood. We'll now take questions from the media, and if you can identify yourself and your station or paper, and we'll take the first question.
First question is Michael Hyland, CBS 17.
Hi, first I wanted to ask about the resources that we're getting from FEMA that you announced today. If people want to utilize that, how do they go about that process if they'd like to get access to any of these rooms that might be available? And then also with this outbreak you told us about in Orange County, can you give us any more details about where precisely this has happened and what notification is going on to family members of people who might have relatives there?
Michael, can you repeat your first question about FEMA? I'm sorry that I didn't hear that one.
Sure. Regarding the resources that are coming in from FEMA for people who might be interested in utilizing that, who might need a place to go, how do they go about getting connected with this program? How soon will it be available?
Okay. First, we are getting some help from FEMA in a number of areas, and we're grateful for that working relationship. Unlike our hurricane disasters of the past, we have not gotten approval for individual assistance yet that we really want from FEMA, but no other state has. We do have help with public assistance, and a number of our hospitals and local governments are able to apply for that, and I'll let Director Sprayberry talk about that. Also, this nursing home that has had this outbreak is in Orange County, and I'll let Dr. Cohen give any details that can be given about that right now. We certainly want to protect the privacy of the patients that are there. But Mike, if you can give us a little overview of FEMA, and then Dr. Cohen can address the other question.
Thank you, Governor, and thank you for that question. Regarding FEMA, we have received a federal disaster declaration for public assistance Category B, which is emergency protective measures. And what that allows jurisdictions and organizations to do is to apply for things like overtime and things that they're doing to respond to the COVID-19 pandemic. Right now, we have close to 1,000 different entities that have entered themselves into the grant portal, and we're close to having 300 folks that have requested, when I say folks, I should say entities that have requested for public assistance. There's another piece to that disaster declaration. We had made a request for individual assistance, which includes things like the crisis counseling program. As the governor said, that has not been awarded yet. Another piece that FEMA has done for us that we're very grateful for is they've awarded us emergency non-congregate sheltering, which allows us to shelter folks in places where they can be separate and apart. They may be high risk, they might be homeless, they could be folks that are stepping down out of an acute facility and actually getting well, but we can put them in dormitories and hotels and motels. And so we're very grateful to get that emergency declaration as well. So that's where we stand with FEMA. Thank you very much.
To share a few more details about the long-term care facility in Orange County. First, I want to say that our local health department has been working very closely with the facility, as supported by the state as well. And I also want to thank both the Duke and UNC health systems, which has also been lending support in terms of doing testing and then obviously caring for those that are hospitalized. As far as notifications for the family, that is being handled by the individual nursing home themselves. Obviously, we do want to protect patient privacy as we move forward. That's why we're able to share with you the county, but not any additional details about patients at this time. Thank you.
Thank you. Next question, please.
Gary Robertson, Associated Press.
In a lawsuit that was filed today by the NAACP, ACLU, and some prisoners asking for the immediate release of people who are at high risk in the state prison system who are at high risk for COVID-19. Well, I know that Attorney General Stein's office will defend the lawsuit. Wanted to know if you or Secretary Hooks had any comment on it, or just in general whether you believe you're protecting the state's prison population at this time.
Thank you, Gary. People who are in our correctional institutes are one of the congregate living groups that we are concerned about, just like people in long-term care and skilled nursing homes. People who are in a confined facility, we have deep concern about spread of the virus. We have concern about the people who are there. We have concern about staff, and we want to do what we can to protect them. Isolating people who have COVID-19, restricting people that can come in, making sure there's significant hygiene, making sure that correction staff can wear protective equipment, making sure that we pay our correctional staff bonus pay. All of those things are important in protecting the population, and I know that Secretary Hooks has been working hard on this issue to make sure that our prison population and staff are protected, and I'll let him address some of the things that he's doing.
Thank you, Governor. Thank you for the question, Gary. As the governor outlined, there have been a number of steps that have been undertaken throughout this entire pandemic, and as we have aggressively responded in North Carolina. All of the quarantine and isolation protocols are firmly in place. Our healthcare individuals and leaders in prisons also regularly consult with Dr. Cohen's staff about best practices, and will continue to move forward in that manner. Right now, we have 14 individuals who have tested positive for COVID-19. And to put that in context, that's in a prison population of about 35,000. And so we're undertaking all the appropriate protocols and mitigation efforts that are necessary for this. I won't comment on any of the lawsuit filings or anything with that, but we are taking this very seriously. Our staff is at the forefront of our mind, as well as our individuals that are incarcerated within those facilities.
Next question, please. We are very concerned about that disparity. Some of it results from lack of health care coverage and lack of available preventive care. Sometimes it results from socioeconomic poverty, and it shows that we need to redouble our efforts across the board to make sure that every North Carolinian has access to quality health care. And when you have a crisis like this, it puts a spotlight on the fact that a lot of people do not have access to quality health care. A lot of people do not have access to a safe, clean place to live, and it causes significant problems across the board, but particular people who are impacted. And I'll also let Dr. Cohen talk about that, if she would. Dr. Cohen.
Thank you, Governor. I think Dr. Fauci yesterday in his press conference addressed this well, which is when we're in a crisis, it does shine a light on the fact that we have ongoing health equity issues all across our country and in North Carolina. I know the governor and I have been working for more than 3 years now to address some of those health inequities, but when you're in a crisis, they play out. Some of the ways we know that our African American community has higher rates of diabetes and heart disease disproportionately, so it's going to have COVID-19 impact them more substantially. I think it's also significant to note about who are our essential workers, and they are more likely to be from our communities of color. There are nurses, there are folks at grocery stores, there are long-term care workers, and they have more exposure risks as we move through this. And I think it just, again, shines a light on long-standing disparities in our health system that we've been trying to address, whether that's through good access to care or the ongoing structural racism issues that we have that contribute to ongoing lower health rates in some of our communities of color. I think it's a problem we'll continue to address, and is definitely on the forefront of how we're thinking about things. It's why we want to be sure to be tracking this data as we go forward into the future, so that we can continue to keep it as a centerpiece of how we think about the current efforts for COVID-19, but the work going forward for the future.
Next question, please.
Alma McCarty, WFMY.
Hi there, this is Alma McCarty with WSMY News 2 out of Greensboro. My question is about whether you, at this point, plan to extend the stay-at-home order.
We know that we have the stay-at-home order in place through April, And it is so critical that people abide by that order and only go out for work and other essential reasons. The data that we have looked at from the analysts show that this is working, and that if people do stay at home, we're going to be successful in slowing the spread of the virus. As I mentioned yesterday, we don't know the answer yet of whether the stay-at-home order will be extended into May, and if it is, what it will look like. We're going to consult public health experts. We're going to look carefully at the data. We're going to look at experiences in other states and other countries. We're going to look at the modeling that our team of experts has put together. We're going to talk to business leaders. We know that we have to cushion the economic blow of this crisis, but we also know we have to keep saving lives and public health at the forefront, which is not only important for humanitarian reasons, but it's important for the long-term health of our economy as well. So we'll look at all of those factors in the coming weeks, and we'll be making a decision about what kind of interventions that we're going to have during the month of May and beyond. Thank you for that question. Next question.
Andrea Blandford, WTVB.
Hi, this is Andrea Blandford with ABC 11 for Governor Cooper or Secretary Cohen. Curious to know more about this outbreak at the Orange County skilled nursing facility. When did the first patient start showing symptoms, and when were they tested? And then what changed procedurally inside that facility in regards to that patient and then others once they started showing symptoms? How did staff respond in this case? Thanks.
We're really concerned when an outbreak begins at a congregate living facility because everybody is so close together, and the steps that many of these facilities across our state has helped to prevent a number of outbreaks and has helped to slow the outbreaks that have occurred. But I'll let Dr. Cohen talk specifically about this nursing facility.
Yes, thank you. So as you know, an outbreak is any time you have 2 or more cases. So the first time we were aware of 2 cases, I believe, was about 7 or 8 days ago at this point. At that time, they're working with their local health departments on some of these activities that we've talked about today, making sure that staff is wearing masks, cohorting patients, and doing testing. As we have seen in other nursing home settings, this virus is very contagious and moves quickly, and sometimes can be spread before you even know folks have symptoms. That is, again, why we are codifying in an executive order some of these prevention methods so we can protect folks on the front end, because we know once the virus is in some of these long-term care settings, it's incredibly hard to control. We are trying to beef up our efforts to do those control measures, but it's incredibly challenging, as we've seen not just in North Carolina, but around the country and around the world. So I think prevention is really our important focus here, which is why we're codifying that in the executive order. And we're going to continue to work with our facilities and our local health departments to support them. And I just want to reiterate again how thankful I am to the workers at these long-term care facilities for doing the hard work that they're doing. It is very, very hard to do infection control in these kinds of settings, and I'm appreciative of all of that they're doing.
Thank you. Next question, please.
Allison Smith, Fox 8.
Hi, Governor Cooper. I know we have seen some retailers already enforcing their own restrictions on limiting shoppers. I'm just wondering, are you all considering a new state order that would limit shoppers inside stores, encourage more social distancing at these essential stores that do remain open right now?
We know that people have to go out and to get groceries and other essential items, and we want people to be as safe as possible when they go. A lot of employers have been very responsible in limiting the number of people in their stores at one time. In fact, limiting it to one entrance, and when the store gets to the occupation limit that the store has set, that you can't let another person in until a person has gone out. And they do have a place for people to stand in line with markings 6 feet apart, so people will not only be socially distant inside the store, but also waiting in line. We commend that, but we think it needs to be across the board in our retail stores across our state. We're encouraging retailers to do that, and we will be issuing an executive order that makes this more uniform across the state, sending the message that in order to protect both the customers there and the employees who are working so hard at these stores, trying to make sure that essential items are available for people, we want both of those groups protected. So it will likely be tomorrow that we would release that executive order for retailers across the state. Thanks. Next question, please.
Dawn Vaughn, News and Observer.
Dawn, are you there?
We'll try Haley Fixler at WGHP.
Hi, Governor Cooper. What is the plan with vehicle inspections and the DMVs? People are worried about getting exposed and being around people, but they're really also worried about getting the fines if they don't go.
I'm sorry, I could not understand the question. Can you repeat the question, please? I'm sorry.
What is the plan with vehicle inspections and DMVs? People are worried about getting exposed and going out and about and being around people, but they're also worried about fines and getting tickets if they don't go.
Yes, we're working on waiving as many fines and penalties as we can through executive order. But when the General Assembly comes back, we have already talked to them about delaying in statute these things that we can't change through executive order. We want to discourage people from going out and having these exchanges for things that could be delayed a few months. So I think that when the General Assembly comes back, you will see some action on that and other things that in the law require people to go out and personally do things when we want to try to curtail that kind of activity. Thank you. Next question.
This will be our last question. Chandler Morgan, WBTV.
Hi, Governor. My question is actually for either Dr. Cohen and also Director Sprayberry. Just some clarification on the new measures for nursing homes since they're required to wear face masks. Is that considered N95 masks or will homemade masks do? And if the N95s are, what's required? Are you all going to be playing a role in making sure they get those? And then the second portion of this was just about the FEMA housing program. Director Sprayberry, how would you be able to ensure that people are being separated in those facilities? Because I know that some people are people who have tested positive for COVID-19, and then some of them are people who you're trying to make sure don't get COVID-19. How would that work?
Sure, thanks for the question. This is Mandy Cohen. I'll address the issue around face masks. So there are several different kinds of face coverings or face masks that folks can wear. When I'm referring to face masks at a nursing home setting, it is a healthcare setting, so we do want to have folks wear what is called a surgical mask or a procedural mask. An N95, a level 3 N95, is really something that is recommended really in a hospitalized setting when folks are doing aerosolized procedures. Other than that, the surgical mask or those kinds of health grade face masks are used to prevent the transmission of droplets, again, both for the patient and for the healthcare worker. We're not talking about in a healthcare setting using homemade masks, which is different than what the CDC might be recommending for you or I as we're at the grocery store or out and about if we wanted to wear some sort of face covering that might be something that is homemade. When we're talking about our long-term care or nursing settings or healthcare settings, we're talking about face masks that are approved by the FDA and have some certain components to them that are appropriate for them, but they are not N95s. I'll let Director Sprayberry talk about the FEMA issue.
Thank you for that question. And so you're talking about the emergency non-congregate care program. And the way that we anticipate that's going to be implemented is that North Carolina Emergency Management, working very closely with the Department of Health and Human Services, would also assist our local partners at the local health departments and their local emergency managers to operate this program. And we would assist them as they put people in hotels and dormitories, and it would be how they would keep them apart. And I think that folks that would be going into these places would have a vested interest in keeping separate. And so they, at the local level, would be managing that, and we would be providing assistance. Thank you.
We thank you for being with us today, and we also want to close by thanking all of the people, as Dr. Cohen and Mike have said, thanking all of the people who work at our long-term care facilities and our nursing homes. I've always thought that even under the best of circumstances, that they were doing the Lord's work. And it is so much harder now as we face this pandemic. We're grateful for their good work. And I know that this team, we're going to do all that we can to try to protect you and your patients. And thank you for being with us, and we'll probably talk to you tomorrow. Thank you.